Doctor, are you duly licensed to practice as a physiatrist? Yes, I am. Is that in the state of New York? It is. Would you be kind enough to give us your educational background? Do you mean starting with college? Yes, sir. I have a bachelor's degree from City College and a degree in physiatric medicine as well. Where is that from? It is from the New York College of Physiatric Medicine. What year did you graduate from that school? It was in 1979. Doctor, are you board certified in the field of medicine? Yes, I am. Is that specifically for physical therapy? Yes, it is. Defendant's counsel, Your Honor, we will concede his qualifications as a board certified physiatrist just to speed things up. The court, counsel, do you accept that concession or not? Plaintiff's counsel, I do, Your Honor, but I would like to ask a few more questions. The court, be my guest. Doctor, how many years have you been practicing physiatry? About 15 years, sir. Are you testifying previously to the court in the courts of the state of New York? Yes, sir. And have you testified at the request of both plaintiffs and defendant? Defendant's counsel. Objection, if the Honor please. The court. The objection is sustained. The concession is on the record. Doctor, will you tell us, are you being reimbursed for your time away from your practice? Yes, I am. You performed an examination of the plaintiff at the request of my office, is that right? Yes, sir, I did. When was the last examination performed? When was it performed? Back in 2002, I would say. I would like you to take us through your physical examination back in 2002, if you can. Defendant's counsel, objection. The objection is overly broad. We don't want a narrative here. The court, narrow it down, counsel, if you don't mind. Where did you examine the plaintiff? In my office. You took a history there? Yes, sir, that is precisely right. That was that history. She said she had a previous surgery. Anything else? And she was allergic to penicillin. Did you also do a vascular examination of the plaintiff? Yes, sir. Was that basically normal? Yes, it was. Was it completely normal, except that she had a little bit of a reduced circulatory condition in her left big toe? Defendant's counsel, move to strike as not responsive. The court, that was your finding? Ask the question over. Yes. Yes, it was. But did you do a neurologic examination? Yes. What did you find as a result of the neurologic examination? I found nothing. What were your physical findings? I find that she had mild callus under the first joint. That joint you are indicating is called what? That is called the firm metatarsal head, I believe. And you say that she had a thickening of the ankle there? Defendant's counsel, objection to the leading. The court, yes, don't lead, counsel. Plaintiff's counsel, he already said he found some callus. The court, don't lead, let the witness do the testifying. Objection sustained. The plaintiff's counsel, exception. What is the significance of having callus there? In this patient, she had pain from excessive pressure. What else did your examination consist of? I took an x-ray of her left foot. What was that for? It was in order to determine what procedures had been done before and what the present condition of her foot was. So I took an x-ray and suggested to her, just a minute, let's try to confine the answer to the question. Let me back up and ask, in podiatric circles, are x-rays considered to be helpful in judging the conditions of a patient? Yes, sir. Would you say an x-ray is a diagnostic test? Defendant's counsel, objection. The court, overruled. Yes. What did you first find from the x-ray? What did I find? Yes, I found that there was a mere fixation on the first metatarsal. Do you mean that you found that condition from that previous condition of surgery? Yes. That's all that you saw? Yes, we noted that her toes were angulated laterally. What do you mean by that? What they were by her side. Briefly, tell us what conclusions you arrived at after the examination of the plaintiff. Defendant's counsel, objection as to form, the court. Do you mean with reasonable podiatric certainty? Plaintiff's counsel, yes, sir. The court rephrased the question. Tell us what conclusion, if any, you reached with reasonable podiatric certainty, if you can. She had some gain in the first interspace. You mean between these two bones? Yes, sir. I judged it had, or it was, coming from the fact that these bones are now operating closer together. And doctor, what was that doing? That was pinching the nerves. Most of the time when she became what we call defendant's counsel, I object, Your Honor, and move to strike all of this as speculative unless he is talking about the condition of the patient herself, Your Honor. The witness, that's right, I am telling about the patient. The court, is everything you are saying related to this patient? The witness, yes, this is my interpretation of her position. And in that plaintiff's case, she had loss of motion and sensation, yes. Did she have pain on Gresha? Yes, and it was my feeling that she should follow that up. Should you say that the compromise of nerves, as you have described, other than the superficial nerves, is a normal part of the procedure, is it not? Defendant's counsel, objection, the court, sustained. Plaintiff's counsel, what are the grounds of the court, please? The court, it is bad in form. Plaintiff's counsel, Your Honor, I would like to approach the bench. The court, counsel, ask your next question. Doctor, do you have an opinion concerning the compromise of nerves in this patient? How's it?
That was good.
Huh?
That was good. What speed was that?
200.